Hello viewers, again we are making a video on one of the requests from our subscribers. He says that his sperm is not getting released during intercourse, even if he is doing intercourse for 15-20 minutes, not even a single drop of sperm is coming out. So this problem is called ejaculatory dysfunction. Basically, in ejaculatory dysfunction, there are different types of ejaculatory dysfunctions. One is anejaculation. Anejaculation means similar to this problem, where sperm will not come out even during intercourse or with masturbation or any kind of stimulation. Sperm will not get released. This is called anejaculation. So again, there are different types of anejaculation. For some people, they can ejaculate during intercourse, but they can't ejaculate during masturbation. That is called masturbatory anejaculation. So, but they can ejaculate during intercourse. Second problem is they can ejaculate during masturbation, but they can't ejaculate during intercourse. This is called intercourse anejaculation. But in this question, where in this problem where patient is not able to ejaculate even with masturbation and intercourse, that is called anejaculation. There is one more dysfunction similar to this, which is called delayed ejaculation. That means sperm comes very late. Sometimes they have to struggle for half an hour, 45 minutes, and they keep losing erections in between because nobody can do sex for half an hour or 1 hour. So after some time they lose erection, again they have to stimulate, they have to try. So sperm releases after long time. That is called delayed ejaculation. So now let us see what is the problem behind this ejaculatory dysfunction. See, in anejaculation, one common problem is lack of masturbation or ejaculatory training. Then imagine somebody who has not masturbated from his teenage days, and after marriage he tries to have intercourse for the first time, then he finds that his sperm is not coming because his system is not trained for ejaculation. So there, in that scenario, we will identify the cause, and then there is a therapy called vibratory stimulation or vibration therapy, where we have a specialized device to stimulate the penis to higher frequencies, and they need, it's like physiotherapy. We try to use the vibrator, and once they vibrate, sometimes they take 1 hour, 2 hours to ejaculate for the first time. And once they ejaculate with the help of vibrator, then what we do is, then we call them regularly and we do it like a therapy. We ask them to come once in a week or once in 3 days. So they have to take this therapy. So slowly their ejaculatory time will come down. The first time if they ejaculate in 1 hour, second time they ejaculate in 20 minutes, third time they may take around 10 minutes. Like that, that is how we tune their system. But there are some people where ejaculation cannot happen. Even nocturnal emissions, during sleep also semen may not come out. That may be because of either blockage in the ejaculatory system, or by birth some people are born without the ejaculatory system. That means sperms are produced in the testis, but it can't come out because there is no way for the semen to come out. There we do a prostate scan and we identify what is the reason behind that. And some people, because of the infection, chronic infections like chronic prostatitis, chronic seminal vasculitis, because of the chronic infection, the nerves responsible for ejaculation, they stop working. So this is related to infection. There also we have to find out what kind of infection it is, and we can treat it. And there is one more problem which is very common in India, which is tuberculosis. So see, normally people think that TB means it comes only in the lungs. Rarely it affects testis and prostate and seminal vesicle. Even because of the infection, this entire ejaculatory system will get infected and completely blocked. So now these are the causes for anejaculation. Sometimes it can be psychological cause also. Sometimes they are worried about other things, sometimes their hormones may be abnormal, sometimes the medications what they take, common medications which can cause ejaculatory problem are some kinds of steroids and some drugs, some marijuana, some drugs will delay the ejaculation permanently. So now we have to evaluate what is the actual problem for this, whether it is blockage, whether it is psychological problem, or whether this is lack of training, whether this is knee infection, and then we can treat them. So these are the possible causes of anejaculation. Thank you.